Hi, good morning. My name is Bernadette Abrigunda from Maryville University. Today, I'll be conducting my head-to-toe assessment with my friend Mike, who agreed to be my patient today. Before videoing this, I had already Mikey taken his vital signs, his weight, and height, and also he did empty his bladder for his comfort all throughout the test. Also, I did also check his vision through Snellen and the Rosenbaum, and on the Snellen, it shows that he have a 20/20 vision. Today, I'm gonna be starting by inspecting his head, his scalp. I could see right now that it's on the middle position, that there's no obvious bumps or any lesions. I'm gonna palpate his scalp for any area of tenderness or any bumps, which is none. So his head is in normal cephalic position and there's no area of tenderness or there's no bumps or lesion. While I'm here, I'm gonna check also his hair, which is soft and nice and smooth, and there's no area of any baldness. I'm gonna check also his scalp for any presence of any dandruff, which is none. His head and scalp is healthy. After checking his hair and his head, I'm gonna go ahead and check his face right now for any obvious asymmetric or any lesions on his face, which is none. I'm gonna start palpating his sinuses. I'm gonna start here on the frontal sinuses. Do you feel any pain?
No.
Okay. I'm gonna go ahead and palpate the facial sinuses. Do you feel any pain?
No.
Okay. Mikey did not feel any tenderness as I palpate his facial and maxillary sinuses. Right now, I will proceed and check your facial bones to assess for any coarseness or any bumps or any lesions, which is none. As I assess his facial bones, I didn't feel any bumps or any presence of any mass. Right now, I'm gonna go ahead and check your eyes. I will proceed checking your eyes first. On the symmetry, his eyes is equal to each other. There's no lid lag or there's no presence of any eye droop. I'm gonna start checking your eyebrows. It should be full, which is he have a full eyebrows on both. His eyelashes is pointed outward, which is good, and also the eyelids. There's no presence of any bumps or any pimples that I could see, which is normal findings also. Can you please open your eyes? Okay, I can see right now that Mikey's conjunctiva is creamy and whitish, which is normal. And also I'm gonna pull up the eyelid a little bit. It's nice and pink. There's no signs of any anemia. I'm gonna go ahead and get right now my pen light to check his eyes further. Okay, very good. I'm gonna go ahead and check. What I just did right now is I checked his pupillary reaction, which is reactive to direct and consensual light. His pupil is reactive to light and accommodation, and both of them are round, which is normal. Right now, Mikey, I'm gonna go ahead and do some tests to check on your vision. Okay. A while ago, I just did the check your eyes through Snellen, but right now I want you to cover your eyes for me. Can you please cover your eyes? The other one, cover it with your hand. Okay, very good. Can you please uncover it? Okay, then do it with the other arm. Okay, uncover it. Uncover it.
Uncover this.
Okay, very good. And that's it.
Okay.
Thank you. What I just did right now is the cover and uncover test. While doing that, I was looking on his eyes for any presence of any nystagmus or jumping of the eyeball, which is none. Also, I noticed that his eyes didn't move as I did the test, which is normal findings also. Right now, I would like to check your visual fields. I would like you to follow my finger with your eyes only. Do not move your head, okay? Mikey's eyes is very smooth when he moves his eyes from side to side and also from up to down. It is well coordinated. I didn't see any nystagmus. His cranial nerve number 3, 4, and 6 is all intact, which is normal findings. Okay, Mikey, after that, I'm going to go ahead and I would like you to cover your eyes for me.
Okay.
Cover the head. Okay, want you to let me know when you see my fingers coming from side to side, okay? Can you
I
see
can
it?
see it, yeah.
See?
I can see it.
Very good. The other one, can you do it?
I can see it. I can see it.
Okay, very good. Right now, I just checked Mikey's peripheral vision and it's all intact. After checking his eyes, I would like to go ahead right now and check his ears. I'm looking right now, there's no obvious lesions and they are all symmetrical to each other. I'm gonna check, palpate your ears for any bumps or lesion, which is none. His skin on his ears is smooth also. Check for the back. Check for the back, and both of them are smooth. So right now, I'm gonna go ahead and pull your ears and do the tag test to feel if there's any tenderness. Let me know if you feel any pain. Okay, up and backward. Did you feel any pain?
No.
Okay, very good. Now I'm gonna go behind your back and I would like you to repeat the word that I'm gonna say, okay?
Okay.
Right now I'm conducting the whisper test to check his hearing.
Apple.
Grapes.
Grapes.
Okay, he repeat the words that I just said, so he's which is good and a normal finding also. Right now I'm gonna do the Rain and the Weber test to check the air and the bone conduction. Okay, Mikey, I'm gonna go ahead and tap this on my palm and put it in the middle of your head and let me know when do you hear the vibration the most? Is it on the right or the left? Okay,
Okay.
or they are equal.
Okay.
Is it equal or
I felt,
more on the right?
I felt more on the left.
Okay, very good. So Mikey said that he felt more on the left. Okay, right now I'm gonna do it. I'm gonna go ahead and do the Ring test and put this in his ear. Okay. Let me know when you stop hearing it.
No.
Okay. Let me know when you stop hearing it. Okay, so while I was doing that, I was timing it, and it shows that when I put it on his mastoid bone, it shows that he have a 15 seconds after he stopped hearing it, and when I put it in front of his ear, it stops in 30 seconds. It only shows that the air conduction is longer than bone conduction, which is normal findings also. After checking his ears, I'm gonna go ahead and check his nose. First, I'm going to check for the symmetry. It's in the midline position. I didn't see any obvious deformity, which is normal. And after checking the symmetry, I'm going to go ahead and check that inside on his nose, okay? First, I'm going to go ahead and look for the septum. It's in the midline position. There's no obvious lesions or there's no polyps. I'm checking the turbinates. It's pinkish, and it's also, I'm checking both of them for the mucosa, and both of them are pinkish. I didn't see any lesions or any gray area which could signify any signs of infection, which is good finding as well. Right now, I would like to go ahead, sir, and check the patency of your nose. Can you please occlude one of your nose,
Okay.
like this, and try to breathe? Okay, very good. And the other one? Okay, very good. Did you feel any hesitancy?
No.
Okay, so both of his nostrils are patent, which is normal findings also. After that, I would like you to close your eyes, and I'm gonna touch your face and let me know when you feel the sensation on your face.
Okay.
I'm gonna apply the on the 3 areas on his face, the light touch. Okay.
Yeah. Yeah.
Okay, very good. So on the 3 areas, the sensation are all intact, which is a normal finding also. Right now, I'm gonna go ahead and proceed to check your lips. I didn't see any lesions or any cracks or fissures on his lips or in the corner, which is normal. It's moist and pink. Right now, can you please smile for me?
Yes.
Okay, I could see that his teeth is all color white. I didn't see any cavitations from the outside or any missing teeth. Can you please open your mouth? Okay, very good. I'm gonna go ahead and shine the light so I could see it further. Okay, very good. I didn't see any cavities on his teeth also. Mikey, can you please stick out your tongue for me? Okay, very good. It's in the midline position. Can you please move it side to side? Okay, very good. He could move his tongue from side to side and it's in middle position. Can you lift up your tongue for me? Okay, further so I could see it. Okay, very good. Open your mouth. Okay, I didn't see any lesion. Right now I'm checking on his tonsil. And both of them are pinkish. There's no redness. Open your mouth more. Okay, and I'm checking also the uvula. It's in the midline position. The soft and the hard palate, which is pinkish also. I didn't see any lesion. I'm checking right now on his gums on both sides, and I didn't see any lesion also, which is good. So Mike's tongue is in midline position. There's no lesions on the anterior-posterior palate and also on the lower palate, and none on the gums, which is a normal finding. Right now, I would like to check the cranial nerve on his face. Mikey, can you please close your eyes tight for me? Okay, wrinkle your forehead. Okay, very good. And then pop out your cheeks. Okay, very good. Stick out your tongue. Okay, cranial nerve number 7 is intact. And also when I just checked the hearing, he have a cranial nerve number 8 intact, which is a normal finding also. Right now, I'm gonna go ahead and proceed on his neck assessment. First, I'm gonna inspect it for the position. It's in the midline position. I didn't see any leaning towards to one side, which is perfect. I would like to check the back also for the cervical position, which is concave, which is perfect too. I didn't feel any masses right now, or I didn't see any bulging on his neck. Right now, I'm checking on the sides for any presence of jugular vein distension, which I didn't see anything. His neck is all flat. Can you please lift out your chin for me? Okay, I'm checking right now the thyroid, and I didn't see any enlargement of the thyroid. I'm gonna palpate right now the trachea. It's in the middle position, which is normal finding as well. I'm gonna go ahead and check this thyroid for any nodularity or any enlargement. Can you please swallow for me? Okay, very good. Can you turn your head towards me? Swallow. Okay, very good. On the other side. Swallow. Okay, very good. I just checked right now his tonsil. I'm sorry. I just checked right now his thyroid for any nodularity, which is nothing. So Mikey's neck, there's no there's absence of jugular vein distension, and also his trachea is in midline, and there's no enlargement of thyroid. So what I would like to do right now is to check the carotid for any bruit. I'm gonna use the bell of my stethoscope to check both of his carotid. I didn't hear any bruit on both of his carotid and also on the thyroid, which is a normal findings. Right now, I would like to palpate the carotid arteries. While checking this, it is very important that you do it on separate time to avoid occluding the circulation. Okay. Just normal findings also. Right now, I would like to go ahead and check your back. Mikey, do you mind taking off your shirt?
No.
I'm gonna go behind Mikey so I could check it. Mikey, do you mind turning on your side?
No problem.
Okay.
Is that fine or
A little bit more.
like that?
Okay. So right now I'm checking on Mike's back. Okay. Let's go this way. So right now I'm checking on Mike's back for any signs of any irritation or near redness on his skin, which is I didn't see. And also I can see right now that the thoracic cavity is in midline position. I didn't see any kyphosis or any lordosis, which is a normal finding too. Right now, I didn't see also while he's breathing, I didn't see any signs of respiratory distress. There's no use of accessory muscle while he's breathing. And the skin also is evenly distributed the color, and it's appropriate for his ethnicity, which is normal. What I would like to do right now while I'm here on his back is I would like to check the expansion of his lungs. But prior to that, I'm going to go ahead and palpate first the tactile primitus. Using the palmar portion of my hand, I'm going to ask Mikey to repeat the words 99 and feel the vibration. Can you repeat the words 99?
99. 99. 99. 99.
The vibration is equal and I didn't feel any abnormal on each side. So I'm gonna repeat it again. Can you please say 99?
99. 99. 99. 99.
Okay, equal vibrations. What am I gonna do right now is I'm gonna go ahead and check the expansion of his lungs using the thumb of my finger. I will put my finger in the 10th rib and ask him to take a deep breath and then watch the divergence of my finger as he take a deep breath. Can you please take a deep breath? Okay. Exhale. There you go. One more. Exhale. Okay, very good. While watching, I did see that there's an equal symmetrical expansion of his lungs as he take a deep breath. While I'm here, I'm going to go ahead also and palpate the costovertebral angle. Okay, costovertebral angle is just right behind the, just right below the intercostal space 10th and 11, which is right here. What you want to elicit here is the tenderness that usually present if the patient have any ongoing problem with the kidney. So which is okay. Did you feel any pain?
No.
Okay. What am I gonna do right now? I'm gonna put my left palm over the costovertebral angle and I'm gonna try to percuss it. Feel any pain?
No.
Okay. Do you feel any pain?
No.
I just percuss right now the costovertebral angle. So what I would like to do right now is to check the I'm gonna percuss his back to check for the resonance or hyperresonance while I do percuss. Using my middle finger, I would tap this on the DP joint to check for the resonance. It's very important that you do it on bilateral or systematically portion. Okay. Perfect, they're all resonant. Okay. Usually that is all resonant that you could hear when you percuss already a dullness area. It means that you are already hitting an organ or a solid organ of a patient. So right now, while I'm here, I would like also to check the diaphragmatic expansion of his lung. I'm just gonna go ahead and repeat again the procedure that I just did. And noteworthy the area from the sounds change from area of resonance to dullness. Mikey, now I would like you to take a deep breath for me. Take a deep breath. Okay, exhale it. Take a deep breath and hold it. Okay, I'm gonna go ahead and check for the resonance. I would like to mark it so I would know how far his lungs can travel after taking a deep breath. Okay, now you could breathe again normally. Okay, take a deep breath. Okay, breathe normally. Okay, breathe normally again. And take a deep breath and hold it. Okay. Okay, it is good 3 to 5 centimeter, which is normal. If it is an athlete patient, it could go as far as 7 centimeter, and the findings could still be normal. After percussing his back, I would like now to hear I'm gonna go ahead and auscultate his lungs for any presence of bronchi or any rales or any abnormal sounds. Okay, using symmetrical portion. Mikey, can you please cross your arms for me? And then bend a little bit forward. Cross your arms. There you go. And bend a little bit forward. There you go. I'm gonna auscultate right now the sounds of his lungs. I'm gonna use now the diaphragm of my stethoscope. Take a deep breath. Go. One more. One more. One more. And now I would like also to auscultate the lateral portion of his lungs. Mikey, if you could just put these arms towards your neck. Okay.
Okay.
Like this. Take a deep breath. Very good. And the other one, please. Take a deep breath. Very good. I didn't hear any bronchi or any abnormal wheezing. Now I'm gonna go ahead and auscultate his anterior portion of the chest. As I put my stethoscope, just take a deep breath. Very good. So I just checked right now his lungs for any abnormal wheezings and I didn't hear anything, which is a normal finding. So right now what I would like to do is to check his chest for any abnormal lesions or any irregularity. I could see right now that he is breathing perfectly. I didn't see any signs of any respiratory distress. He's not using his muscles to breathe in. What I will do right now is I'm going to go ahead and palpate his chest wall. I didn't feel any hips or any trills, which is a normal finding. So after that, I'm going to check also the tactile parameters by asking him to repeat the word 99. Can you please repeat the word 99?
99. 99. 99. 99.
I didn't see any difference also on vibration, which is normal findings as well. So right now I would like to locate the PMI, or which is the maximum impulse over here on the left intercostal space. Okay, it's present also, and I didn't feel any bounding pulse as I checked the PMI or the mitral pulse. Right now I would like now to check the heart sounds of Mike to see for if there's any presence of any abnormality or irregularities. I'm gonna use right now the diaphragm of my stethoscope. First, I will auscultate the aortic at the second intercostal space. Next would be the pulmonic on the second intercostal space as well. The Erb's point on the third intercostal space. The tricuspid and the mitral. I just heard the S1 or the S2 sounds. There's no extra gallops or there's no murmur, which is a normal finding as well. Okay, thank you for cooperation. Right now, I'm going to go ahead and check your arms, okay? Can you please see? I could see right now that Mikey has some tattoos on his arms and on his chest, but there's no any rashes or any signs of any infection going on his arms, which is good. While his arm is up, I checked also that there's no presence of any tremors, which is good. You could put it down now. Okay. I'm checking his hands, which is good. It's smooth. The nail bed is pinkish. There's no bluish or there's no clubbing on his fingers. The capillary refill is under 3 seconds, which is normal findings too. Okay. Maki, since I'm here, can you please shrug your shoulder for me? Okay, cranial nerve number 11 is equal, and I could see also during those procedures that he's shrugging his shoulder, his arms or the shoulders are equally going down together. There's no signs of any irregularities. And here right now, I'm gonna go ahead and check the axillary pulse, or I'm sorry, which is the axillary lymph nodes to see for any tenderness. There's none. Okay. There is none also, like I could feel right now the brachial pulse. It's not bounding, it's just regular. And the radial pulse, which is normal also. Okay, thank you so much. While doing that, I forgot to do the palpate your lymph nodes on your face and in your neck, which I would like to do it right now. Okay, I'm gonna palpate right now the preauricular lymph nodes, post, occipital, posterior cervical lymph nodes. I'm doing right now to your mandibular, submental lymph nodes, the tonsillar, the anterior cervical, the supraclavicular lymph nodes, and the infraclavicular lymph nodes. I didn't feel any tenderness on the lymph nodes as I palpated, which is normal finding as well. So after checking his chest and his lungs, I would like to go ahead and check right now the abdominal portion, the abdomen of Mikey. Mikey, I'm gonna ask you to lie down. Okay. I'm gonna go ahead and check here on the right portion. I'm gonna check first the symmetry of his abdomen. I'm gonna shine the pen light to see for the contour. Okay. I didn't see any bumps or lesions, which is good. Can you please take a deep breath for me? Okay. Very good. I didn't see any also bumps or lesion. His skin is smooth. There's no area of bluish discoloration or there's no hematoma when I check his abdomen, which is normal findings as well. After checking it, I would like right now to auscultate his lung. I am to auscultate the abdomen, the fourth quadrant of the abdomen. I'm gonna start with the left quadrant. Very good. Left lower quadrant, right lower quadrant, and the right lower quadrant. I could hear that all on the four quadrants, the abdominal sounds are all equal, and it's approximately 5 to 35, which is a normal finding as well. While I'm here, I'm gonna also auscultate the arteries on his stomach. I'm gonna start with the aortic artery. On the left kidney, right kidney, iliac arteries, left arteries, the femoral, and the left femoral. I didn't hear any brewing of the sound, which is the normal findings. Right now, what I would like to do is just to palpate. I'm gonna go ahead and percuss the liver. But prior to that, I would like to percuss the tone of his abdomen. Very good. It is all tympanic sounds, which is normal. Right now, I'm gonna go ahead and percuss the liver border. I'm gonna start here from the right clavicular area and note when did the change of the sounds occur from resonance to dullness. Very good. Okay, so it's approximately 8 centimeter, which is normal findings as well. So right now I'm gonna go ahead and percuss the spleen border on the left side. Mikey, can you please side a little, turn a little bit? Okay, very good. Okay, so it's right here. I just palpated right now the spleen border of Mikey, noting also the sounds where it changed from the resonance to dullness. Thank you so much. What I would like to do right now is to palpate his stomach to feel for any masses or any tenderness or any enlargement of the organ. I'm gonna start palpating it lightly. Tell me if you feel any pain. Okay, did you feel any pain? No. Right now I'm gonna do my deep palpation. Okay. Good. Palpating the left kidney. Okay, there we go. Right kidney. Did you feel any pain? Okay, right now I'm gonna go ahead and palpate the border of his organ. I'm gonna start with the liver. Okay. I didn't feel it. Which could be a normal finding. Sometimes you can feel the organ. Right now, I'm gonna put the left portion of my arm over here and then try to palpate your organ, the liver. Okay, I didn't feel also the spleen. If you feel the spleen, it could mean any problem on the patient. There's ongoing infection, or we have to anticipate some splenomegaly that we have to report on the physician. Thank you so much, Mikey. Now you can sit down. I just checked his stomach right now. Right now, I'm on the last portion of the test. I'm gonna go ahead and proceed to check the lower extremity of my patient. Looking right now again on the legs, I didn't see any signs of any rashes or any redness, which is a normal finding as well. The hair is distributed equally. There's no area of bald spot as checked on his legs right now, which is normal. I could see also that the feet is perfect, that there's no some rashes or there's no any sign of fungal infection, that the nails also have a under 3 seconds capillary refill. While I'm here, I'm gonna palpate the pulses, Mikey, okay? I'm gonna do the dorsalis pedis, which is palpable. I'm gonna go and palpate right now the posterior tibial, which is good also. And I'm gonna go ahead right now and palpate Mikey's popliteal pulse, which is normal. After doing so, what am I gonna do right now is I'm gonna elicit the reflexes. From the arms, I'm gonna start right now on the brachial. Okay, what I would like to expect right now is just a little bit of jerking movement as I tap on the brachial. Just normal. I'm gonna percuss right now the patellar reflex. Okay. Okay, very good. I want you, Mikey, can you please move forward so we could check the so I could elicit right now the Achilles tendon reflex. What you would like to expect is some movements over here, but not exaggerated movements. Okay, very good. So I just checked right now his reflexes and everything is all intact. So I'm gonna go in the back right now. Mikey, can you please stand for me?
Stand?
Yes. And then turn back. Okay. I could see right now that the cervical has a concave shape and the thoracic is in the midline. There's no signs of any curvature. Can you please lean forward a little bit? Okay. I could check right now that the hips are equal to each other, which is a normal findings. Thank you so much, Mikey. Can you please sit down? And that concludes my head to toe assessment. Thank you so much.